My name is Chris Nelson. I want to welcome everyone to our first back to school town hall of fall semester 2021. Today we're going to focus on back to school preparations related to the coronavirus and COVID-19. Today we're going to hear from President Taylor Randall. We'll also hear from Senior Vice President Good, Senior Vice President Dr. Reed, Vice President Lori McDonald, and our Chief Human Resources Officer, Jeff Herring. Before we get started, I do want to remind everyone who's watching, coronavirus.utah.edu is your source for information. The site continues to be updated. There's information there about vaccination and testing, all sorts of protocols, exposure protocols. So again, if you've got questions from this, please make sure to visit coronavirus.utah.edu. I also want to remind everyone the transcript from today's broadcast will be posted online and people will be able to watch this as well. So we're going to start with some brief remarks from President Randall. We'll move to Dr. Good, and then we're just going to get right into some of the hard questions that have come in. So with that, Dr. Randall, the time is yours.
Thank you, Chris. I want to be the first to start welcoming all of you back to campus. We're excited to begin a transition back to a lot of in-person learning. Before we get into the heart of what we're going to talk about today, I think I need to express deep appreciation to every member of the campus community, the leaders, line workers that have kept us safe as we've moved through this pandemic. It's really been a remarkable effort. Our goals this fall are the same. We want to keep all of you safe, every single member of the community, the best we can, while welcoming our students back. I spoke with some of our student leaders this morning, particularly in the undergraduate population. They're very excited to be back for in-person learning and really want to have a connection with us. And so we hope you'll enthusiastically welcome them back. As always, I think we have to remember that these are trying times. It's not anything any of us have been through, and there's a lot of uncertainty. So if we can be patient with each other and remember that the pandemic is the short-term thing here, and it's the relationships we have with each other and with our students that is long-term. Let me express as well appreciation for Dr. Good and Dr. Reed for their leadership through this entire process, and particularly Dr. Good for serving as interim president. I'm now going to turn the time over to him. As you know, he's served multiple roles, and in particular, he is one of our state's most trusted leaders during this pandemic. So Dr. Good, over to you.
Thank you, President Randall. As I'm sure everyone has been following, as vaccines began to be rolled out in our country, we saw the case levels of coronavirus come down and sustain at pretty low levels for several months. And then over about the last 6 weeks, in large part due to the Delta variant of coronavirus, which is highly transmittable and somewhat more virulent than the original coronavirus, our case counts have come back up. Many of you follow every other week on my blog. I post a video update. And for the last couple of sessions, we've seen here in Utah, the number of new coronavirus cases on a daily basis increase. And we've seen hospitalizations across the state increase as well. As hopefully you saw the communication from Dr. Reed and I about a week and a half ago, asking our campus community to do 4 things. Number 1, get a coronavirus vaccine, get vaccinated. I'm happy to report that over 80% of employees, those who have health benefits from the University of Utah, over 80% are already vaccinated. And of the students who attended class during summer session, over 70% were vaccinated. So we continue to ask everyone, please get a coronavirus vaccine. The vast majority of patients with COVID in our hospital are unvaccinated. 90% or more are unvaccinated. Get a vaccine. Number 2, if you're not vaccinated, please get tested weekly. We have coronavirus testing available to all students, faculty, and staff. It's easy, it's saliva-based. Results return often, usually same day. 3, wear a mask indoors. We're asking all faculty, students, and staff to wear masks when they're indoors. The masks slow down the spread of virus from person to person. And fourth, we're asking leaders, student leaders, staff leaders, faculty leaders, university leaders to lead by example and model these behaviors. So, and I've been very pleased in the last 10 days as I walk around campus, I do see masks being worn indoors in buildings and activities where 3 and 4 weeks ago they were not. So I want to thank all of you who have risen to our ask to get vaccinated, to get weekly testing, to wear masks indoors, and for leaders to model these behaviors. Jeff, I'm sorry, Chris, who do my lateral paper is not here. Where do we go?
I'll take it from here. Thank you. Thanks for that overview. All right, so now we're just going to get into the questions. First, I want to thank everybody who submitted questions. Thank you for reading At the U every week and knowing this was coming up and submitting questions. And for all of our panelists, I'm going to kind of crank through these questions. And I think, I'll call on you. But again, if you want to add to a question, we'll do that. Dr. Good, we're going to come back to you. The first question we received is, I think there's a lot of confusion maybe out in our campus community about which health guidelines the university following. Do we have to follow the CDC? Are we following the county, the city, the state? Can you kind of break that down for us with these different recommendations and what advice we're listening to as we develop our plans for campus?
Well, I think everyone needs to remember we are the University of Utah. We are a state university, and as a state entity, we must follow state laws. So first and foremost, we follow state law. We do keep an eye on a variety of things. Certainly in healthcare, we keep an eye on CDC guidelines. For example, one of the reasons that we're asking all faculty, students, and staff to wear masks indoors is based on guidelines that have come out from the CDC. And we similarly watch the health department and others in their recommendations. But the specific answer to the question, while we watch and we process information from many bodies, if you will, as a state entity, we must follow state law.
Yeah. Dr. Reed, I'm going to ask the same question because I know you get this from faculty a lot. And at risk of being redundant, why can't the university require face coverings or vaccines? Why can't we just say, you know what, everyone needs to do this?
Oh, it's a good question, and it actually is I'll elaborate on Dr. Good's answer. We are a state institution, and we are bound by state law to abide by state law. And so there are two bills, House Bill 308 and House Bill 1007. Those explicitly say that we cannot require vaccinations and we cannot require face coverings. We're also mandated to have the majority of our classes in person. Those laws apply to all state higher education institutions in the state of Utah. So those are the reasons why we can't. We are, as a state institution, required to follow state law. I want to echo what Dr. Good said, though, at the outset, that we are strongly encouraging people to do the four things he mentioned. If you've not been vaccinated, please get a vaccination. If you are not vaccinated and choose not to, wear a face covering and engage in regular testing. But above all, we ask everyone to exhibit the best practices, which are face coverings indoors and get vaccinated. But by state law, we cannot require either vaccination or face covering.
Excellent. Yeah, for those watching who may not have been on campus this summer, I from personal experience, I know there's been a lot of conversation, a lot of planning going on behind the scenes. Dr. Good, I know one of the questions we received in different forms was contingency planning for different scenarios during the fall semester. And the kind of the elephant in the room is there a possibility that the university would go all back online for its education? Oh, Dr. Good, unmute, sorry.
Something that obviously this pandemic, the coronavirus, has taught us is that, in the end, we did not anticipate having the Delta variant, which is in large part the situation we find ourselves in now. And so I want to emphasize and I want to thank the students and the staff and the faculty. We had very low levels of coronavirus on our campus, both fall and spring. I am confident that we together will take actions and exhibit behaviors that will keep this virus at a low level. If things change, we will adapt and change as well. But there are just so many possibilities. We have mathematical modelers that show this wave coming and going and dissipating and having low levels of a virus, if you will, in the coming months. And we have other models and predictions that say that there'll be this sustained kind of level of coronavirus. So I think we will continue to work together, but I think to try to itemize all of the different possible scenarios is really not possible at this time.
Yeah, and as everyone has said, we've got contact tracing teams in place. We've got asymptomatic free testing that's being offered. We've got the vaccine. So I know that the systems are in place. Dr. Good, a couple of questions came in around folks who who don't see. If you've not watched Dr. Good's, let me pitch Dr. Good's weekly updates. If you've not seen those, if you go to the healthcare websites, really good information. But for those maybe who haven't been paying attention to that, I just want to press you again on what you're seeing at the healthcare system. I know you mentioned it before, but maybe you could just reiterate. The patients who are getting sick and being hospitals right now, primarily unvaccinated, correct?
There's kind of three things happening. As far as COVID patients at University Hospital, in the peak of the pandemic, we had between 90 and 95 patients with coronavirus in University Hospital. In those months, as the virus transmission came down, we had a long period where we had around 10 to 15 to 20 patients in the hospital and stayed there for quite a while. In this last 4 to 6 weeks, it's come back up to where we have 35 or so coronavirus patients in University Hospital. So is University Hospital full of COVID patients? No, there's approximately 35, and they're being well cared for with state-of-the-art care. Is University Hospital full? Yes, it is absolutely full. What we saw over the summer and the end of the spring and into the summer, both the growth of our community and the high quality of care that people get here at University Health. And then we do see a lot of what we're calling catch-up care, healthcare that was deferred and not pursued during the first year of the pandemic. Patients now wanting to get those preventative checks in, to get perhaps surgery that's not time sensitive. They want to get those procedures now. So University Hospital is very full, but it's not, it's like I said, about 35 COVID patients today. Again, the vast majority unvaccinated. We also are seeing this same phenomena is playing out statewide and nationwide. And so the workforce, we have over 1,000 vacant positions in the health system. And this is impacting our ability to deliver care. We're working hard to recruit, to retain, to advance our workforce, both in our training programs and in our draw across the country. But so kind of three big factors do result in a full hospital, but it's not from the COVID patients per se. They're just a part of the situation that's going on.
Yeah, thank you. And again, I know everyone on this campus is grateful for those frontline healthcare workers we've got, and we're so all very proud and excited to be part of this organization. All right, now we've done the big questions. We're going to get into some specifics now. First category is kind of around face covering. So, Dr. Good, I'll throw this one to you. do I still need to wear a face covering indoors? I've been vaccinated. Why do I still have to wear a face covering? Well, why are you encouraging, why are we recommending face coverings?
The short answer is Delta variant. The Delta variant is very transmissible. Hopefully you've seen the headlines, as transmissible as chickenpox. Some of us that are older parents remember taking our chickenpox. The disease is less severe the younger your child is. And so we used to take somebody in the block would get chickenpox and we'd all take our children over for play date. Chickenpox is highly transmissible. Delta variant is in that same level of transmission. And we are seeing vaccinated individuals carry or become, if you will, inoculated with coronavirus. Many do not get sick. Those that get sick often only get mildly ill. Many of you may be tracking in Massachusetts on Cape Cod during the month of July. There were many social events in that community without masks among very many vaccinated individuals. 400 or so individuals became infected with coronavirus. 70% had been vaccinated. Now, of that 70% of the 400, only 4 were hospitalized and no one died. So I really want to emphasize the vaccine is effective. It drastically reduces and usually prevents illness, and it drastically reduces and prevents death, but it does not prevent an individual from encountering coronavirus and potentially transmitting it to others. And so that's why the CDC and we are now recommending that when indoors, that we wear masks, whether we're vaccinated or not.
And Dr. I've heard you use the analogy of a coat in the wintertime. Do you want to share that with the group?
Sure, I know we've had a lot of conversations around masks. I would like us to begin to destigmatize masks. Many other cultures around the world that have been challenged throughout history by more pandemics than we have here in America. When viruses are spreading, the community puts on masks, and when the virus has slowed down to low levels, the masks come off. I've made the analogy to a coat or a jacket. When the weather turns very cold, we put on a jacket to protect our body heat, and when it warms up, we no longer wear jackets. We don't need to protect that body heat when it's warm out. And we certainly don't have, pro-jacket and anti-jacket conversations each winter when it gets cold. It gets cold, we just put the jacket on. And I hope as we encounter and continue to encounter this virus and potentially in the future encounter other viruses, that we just realize that a mask is something you just put on when the virus's transmission is high, and you take it off when the virus transmission is low, just as we do with the jacket and the changing of the seasons.
That seems pretty straightforward. That seems like a pretty good bit of advice. All right, Dr. Reed, there's 2 groups out there. I'm worried my instructor or my professor is going to require face coverings, and/or I'm worried my instructor or professor is going to prohibit face coverings. You go address that for our students and our faculty?
Of course. And first, I sort of like to encourage everyone to start from a position of empathy and mutual support. We're all in this together, and navigating this process, as President Randall said at the outset, requires us to work collaboratively and meet people where they are and respect them and their perspectives. So I would just encourage people not to ascribe maybe nefarious motivations to people, but to meet them where they are. Having said that, as I said a moment ago, the University of Utah cannot require masks, and what we really want to be is mask friendly. And so if you want to wear a mask, and we're encouraging you to wear a mask indoors, please do so. If for whatever reason you choose not to, we need to respect that personal choice. And so we have to be respectful of individual choices wherever they go. And so faculty can't require masks in class. We can certainly encourage them from a public health perspective, as we are, but we cannot require them. Nor can we discriminate against students who might make one choice or another. So for example, segregating students on one side of the classroom because they are or are not wearing face coverings, we cannot do that. We have to treat everybody the same, regardless of their personal choice. And as with any state law, we are bound to enforce it. And so, but first I would start with recognize and meet people where they are, encourage best public health practices, but respect individual choice. That's what we're bound to do.
Excellent. A series of questions about vaccines. So Dr. Reed, I'll start with you again. A lot of questions, and Jeff Herring, maybe you step in on this one as well. Can we ask if someone is vaccinated? Maybe we could address it both from a faculty staff perspective as well as a student perspective. Dr. Reed?
Well, you can certainly ask. We're not prohibited from doing that, but I would suggest that the first question you should ask yourself is, why are you asking? If you intend to treat one group of faculty, staff, or students differently than another because of the answer, either affirmative or negative, you should think twice about that. As I just said a moment ago, we have to respect personal choice and treat people based fairly and equally based on those choices. So it's true for masks, it's true for vaccination as well. Now, there are some exceptions to that. Our contact tracing teams, and we will continue to do contact tracing just as we did last year. And we've learned a lot about how to make that even more efficient and timely. We'll ask those questions because that will provide information to help us make decisions about what we might need to do when students, faculty, or staff have been exposed. So all of this comes down to mutual respect. But as I said, you can ask, but think really hard about why you're asking. If it's to treat people differently, then you're probably better off not asking.
Excellent. Let me get some others into the conversation here. Dr. McDonald, a lot of questions around, will you require vaccination for COVID-19 vaccinations for students?
Yes, that is a big question. We do know that many universities are. As Dr. Reed has mentioned, we as a state institution want to be very careful to follow state law. And there is, I think Dr. Reed mentioned it, I believe it was House Bill 1007, that prohibits the state entities from requiring or mandating a vaccine while it's under this emergency use authorization. And I think we are all waiting with much anticipation for that process to go through. I know the Pfizer vaccine, the Moderna vaccine have applied for that, and the FDA looks very carefully at a lot of different data to determine when that might be lifted. When that might be lifted, the university, yes, will look at whether that matches with our procedures and our strategies. We have required our students to demonstrate measles, mumps, and rubella vaccination. And so we do have a bit of an infrastructure for students to be able to demonstrate that they do have the documentation for that if we were to get to that point. And we've also had religious and medical exemptions. And we will add to that with state law a personal exemption. So the short answer to the question that I've given a long answer to is yes, it is possible in the future. We want to make sure that we have the infrastructure for students to be able to do that very readily, to upload their shot records, and also to be aware of those exemption options. And so I believe we'll be in place to do that, and then we would determine when the timing of that would happen if that's the direction we want to go.
And the good news is all indications indicate that our students are getting vaccinated. They want to be vaccinated, which is what we would expect of the greatest students in the world at the University of Utah, right?
Oh, I like the way you put that. Yes,
Yeah.
very much so. We do not have individual information, but for the summer, we can compare our enrollment data with the state data. I think even Dr. Good had mentioned that in the past. It's not giving us personally identifiable information, but we can kind of see in the aggregate what percentage of our students have records of a vaccine in the state of Utah. And so we've been doing that for the summer, and all indications are that 71%, at least 71% of our students had received a vaccine. And again, that's comparing to Utah data. We do know that we have a number of students who are out of state. And I know many who indicated to me that that's where they received their vaccine. And so that's where we believe it would be even higher than that percentage just because of that gap in the data. We will be looking to that for the fall. We have already had some of our incoming students uploading their vaccination records for the measles, mumps, and rubella, and are indicating COVID-19 vaccinations as well. I anticipate it would be similar. With that, we are strongly encouraging the vaccination and trying to make it as accessible and as easy to get to as possible. We will have vaccination clinics all week long next week for our move-in, for those who are moving into housing and residential education, along with a vaccine clinic at FanFest and multiple other events throughout the months. And all of that is, Chris has said, coronavirus.utah.edu has a link to all the vaccination information and sign up right there off the homepage.
And if students and parents have questions specifically about housing, we would encourage them to go visit the Housing Residential Education. I know they're doing a great job. There are some specific issues. We're going to run out of time here today, but I would just push them back up to HRE for that.
Correct. There's a whole coronavirus webpage for those who are living in housing and residential education, going over move-in guidelines, testing guidelines, all of that. Thank you.
And again, our students last year demonstrated that they are exceptionally good at navigating this. Jeff Herring, some HR questions for you. I'm just going to rattle off a couple. So the first one, kind of same question. If we were to get to a place where we required it for students, would we do the same for faculty and staff?
Pretty much the same answer, Chris. If that's the decision we make for students, it would likely be the same for faculty and staff. But again, the same exceptions of medical, religious, and personal exceptions would be available for faculty and staff as well.
All right. As an employee, what if I have high-risk individuals in my home or younger children who can't be vaccinated? Do I have to come to campus?
First, let me say I empathize. I've got an 11-year-old that I desperately want to be able to get the vaccine and are eagerly awaiting that time. That being said, just as it's been mentioned before, that we are required by statute to have in-person instruction for this fall semester. Therefore, in-person instruction and the activities to support this are essential functions of the job. That's how we view this. For institution of higher ed particularly. It's different. Oftentimes I get to say, well, we've been working remotely for the last year. Well, it is a different situation because while people were working remote last year, the students were primarily learning remotely as well. With the students coming back on campus, that necessitates a different type of workforce to address the student needs and those people that support the institution. However, we do understand that there are individuals with high-risk individuals that are at home that are unable, not unwilling, to get vaccinated. And so let me be clear, this isn't just the fact that they're under 12 years old. They need to be 12 years old and have a high-risk condition defined by the CDC. That's where we're looking to the CDC for using of the TWA process that we've got on that. So that's how we take care of that. It does require those TWA processes I can talk about a little bit more, as we get into that, Chris, but it requires medical certification for those CDC criteria.
Well, let's jump right to that. So again, TWA is a temporary work adjustment. We've been all learning these new acronyms and as well as ADA accommodations. Do you just want to give an update on both TWAs and ADAs and where we're at as of right now?
For sure, I can. Let me first start kind of tagging on to what Lori had mentioned about the student vaccination rate, is that we have a vast majority of our workforce, I think I'm preaching to the choir here, is vaccinated. At least 83% of our benefited staff have, we've been able to get that aggregate number as well, but at least 83% of our benefited staff have been vaccinated. And all indications are that our non-benefited staff are even higher than that. So because we have access to this highly effective vaccine, we aren't providing TWAs the same way we did prior to the vaccination. If there's an actual underlying disability that someone has that prevents them from getting the vaccination, we ask you to contact HR and we will deal with that through an ADA accommodation. We're reserving these temporary workforce adjustments that you've been talking about, Chris. We're reserving those to high-risk individuals that are unable to get a vaccine or live with someone who are high risk, again, that CDC definition, and unable to get the vaccine. The TWAs need to be submitted to HR. we are going to review them for meeting the criteria, but then they go back to the department for analysis and approval. So just to emphasize that that is not a HR decision of whether they're approved. We certify that they are, came in and the request has been made, but then it goes back to the needs of the department in making that analysis.
So Jeff, if someone has a question, is someone's looking at this and confused, well, best step one is what? To reach out to HR, to reach
out to your HR representative. We've been having this discussion for the last 18 months and specifically with regards to this and planning since early spring. So the HR team is well versed in this. We have discussions on it weekly, if not daily. So please reach out to your HR team.
Yeah, and again, just remind everyone, coronavirus.utah.edu, the hotline number is there, the information is there. It's a great place to start. And again, I think that the message from everybody is just reach out if you've got questions. No reason to struggle with this yourself, and there's a lot of resources out there. All right, we're in the kind of the second half. We'll kind of crank through these. A lot of questions about testing. Dr. Good, I know you touched on this, but I'm going to just ask it a slightly different way. The question that came in, do students, faculty, and staff need to get regular asymptomatic testing if they're vaccinated? And the question was, is campus still offering this testing? The answer to that second part, of course, is yes. But how do you respond to that first one? For folks who are vaccinated, do they still need to be tested regularly?
I just want to make sure our campus community, we have a very good testing program. A shout out to our Vice President for Research, Dr. Andy Wyrick, and also Dr. Will Deere and Dr. John Phillips, who run our Health Science Center cores. We're using the research sequencers to run a very high quality PCR test looking for coronavirus. We collect saliva, so no nasal swabs. It's a saliva-based test. It's been validated through comparative studies. And we have scheduled collection at the Officers Club and at the Union. Again, the coronavirus.utah.edu, search for asymptomatic. You can schedule an appointment time. The times I've gone, every time I've been in and out of there in 10 minutes. I usually get tested in the morning and I get my results somewhere around 2, 3, 4 o'clock that afternoon. The first and foremost, I want to reemphasize, if you're not vaccinated, please, please, please get tested regularly. You can carry this virus without knowing about it, and that's where the tests are most useful. If you are vaccinated, you are much less likely to carry the coronavirus, although it is not zero, and it's a little bit higher with Delta, the Delta variant. If you're able to get tested weekly, I would encourage that. I want to make sure people realize it is available. Have I done testing myself being vaccinated weekly? No, but probably every 2 or 3 weeks I get tested, either because I've been in a large group and I'm a little bit nervous that maybe I was in a group where somebody may have had coronavirus, or I'm traveling out of town and I want to make sure, visiting family, I want to make sure, add another extra step that I'm not inadvertently carrying the virus. So we make the testing available to everyone, whether you're vaccinated or not. We really, really want unvaccinated individuals to test at least weekly, and then others to test as often, weekly, or as their schedule permits, or as their life circumstance permits. It is available to all members of the community.
Yeah, and it really has been super efficient, and the students who are helping with that have done a remarkable job as well. Dr. Reed, coming back to you for some specific questions. Do campus community members still need to report if they get COVID-19?
Yes, same process as we use since last spring. If you're symptomatic or asymptomatic/exposed, you and your supervisor can report that. Again, we keep saying this, coronavirus.utah.edu/reporting. And timely reporting is as important as it has always been, because that's how we do contact tracing and make decisions about quarantine or isolation. And just to be clear about the difference between those, remember that isolation is to separate people who are sick and test positive. Quarantine is for those who may have been exposed but not necessarily positive while we wait for the incubation period. So yes, you still need to report. It's really important for us to be able to track the spread.
So, and I don't know if you just want to push people to the website or actually answer this. In terms of isolation, what we expect if you've had a positive exposure, what are we looking at in terms of classrooms? What does that process look like?
Very similar to what we did last spring. If you're COVID positive, isolation is still going to be required. If you're unvaccinated and exposed, you're expected to self-report, as we've talked about before. It's possible that we may need to quarantine some classrooms, just as we did last year. But of course, the most important thing to do is exactly what others have said. First of all, get vaccinated. We encourage you to wear a face covering, get tested regularly, whether vaccinated or not. But basically the same process we used last year, we will continue into the fall.
From a classroom perspective, if an instructor or faculty member needs to isolate or quarantine, can they teach via Zoom temporarily?
They can. I mean, it obviously would depend on the severity of their illness. If they're severely ill, we would want to hand that course off to someone else in the unit to manage that in the transition, and that would be a unit level responsibility. And we know that multiple colleges are working on contingency plans for that. So yes, certainly in that interval, if the faculty member felt healthy enough to continue to teach in that temporary period, then yes, they could do that remotely. But then we would expect after that for them to return to the classroom if it were an in-person course.
Okay, I got a few more questions left. If you guys can stick, if you all can stick with me just a little while longer, we'll get through these. Back to campus and student life. Dr. McDonald, how are we supporting the mental health needs of our students and faculty coming out of what arguably is, well, not arguably, I guess, a rough year?
Yes, I think I've been so encouraged about the discussions around mental health, even over the last 5 years. The stigma has, frankly, this new generation has helped my generation destigmatize these issues and talk about them more. And what we know is that incidents of isolation, depression, anxiety, loneliness, distraction have increased over the pandemic. It's both amplified what was already there and increased it. And so I think, number one, we all need to be a part of this community. I loved what President Randall said at the beginning, that, you know, this pandemic, we hope we will move on from, but the relationships that we have are long lasting. And for our campus community to be caring of one another, a lot of times it comes down to just asking how everyone is doing. Also being aware of what those resources are to be able to refer students, especially, of course, but faculty and staff as well is really important. We have a number of student mental health resources available, from counseling to crisis response to mindfulness to, we are just unveiling a new digital platform, You at College, which is intended to help students at all levels with some coping mechanisms, some resiliency, and knowing what those resources are. Those are all available on the Student Affairs website. We have a button that says Student Mental Health Resources, and trying to put it all in one place. For faculty and staff, we have the Resiliency Center with Utah Health. We have the Employee Assistance Program. So there are resources outside of it. I am also very happy that we have had over 200 staff, students, and faculty participate in mental health first aid, which is very similar to first aid training for those of us who are not medical professionals. There's a mental health first aid curriculum that is nationally recognized, and we've brought that here to the University of Utah. And it's just that, tools and skills to learn how to be as supportive to someone who's in a mental health distress as possible. Those are available and ongoing, and that's also on that Student Affairs webpage. So I think let's be caring and understand that this is that much more difficult, but also utilize the resources we have.
What should students expect in terms of outside the classroom? Are we back to normal, hybrid?
Well, that's the other thing President Randall mentioned, what I'm hearing as well from undergraduate and graduate students alike, professional students. There is a mix of anxiety, but excitement to come back. And we know that engaged learning curriculum is something that is of great desire, as well as those social connections, those extracurricular connections to build relationships and to seek out opportunities to build our communities. What we've learned during the pandemic is similar to the curriculum. We can offer programming services in hybrid fashions, have multiple choices for a student to select a virtual appointment with an academic advisor or an in-person appointment with an academic advisor or counselor. We will have programming that may have both options, either show up in person and or connect virtually, or one or the other. So I think we're going to see a lot of creative opportunities to build community, both for student clubs and organizations, as well as student services and support resources.
Fall break and end of term.
Yes, we are back. Thank you. We are back to a more traditional semester schedule, and we will have a full fall break. Off the top of my head, I believe it's October 15th, but Dr. Reed might be able to correct me on that.
My notes say October 10th to the 17th.
Thank you. Thank you. See, 15th was in there. That week will be fall break, and we will have a Thanksgiving weekend holiday, but courses and final exams are planned to resume after that period as well.
Excellent. And of course, the registrar's office has all this information. So
yes.
I'll always, trust that more than us probably. Jeff Herring, a couple of questions around employees. Dr. McDonald talked about the student life. A lot of questions about employees, guidelines for meetings, gatherings in person. Can my boss require me to come into the office and have to work in person?
Chris, we want to be as safe as possible, but also work in confines of the state statutes that are out there as well. To that end, I don't know if anyone has recognized, but we work on a very large campus. It has a lot of people around it. So we can't be prescriptive all the way across campus. So we've given supervisors, department chairs, deans, a lot of latitude because they are the closest and they understand best the workforce needs that they've got. That being said, we put some values out there of how to help them make those decisions. The best interest of the student experience on campus, student experience is important. But I want to mention that we've got about 60% of our employees, Lori mentioned the new normal, about 60% of our workforce will be working in some sort of hybrid or relationship where they're on campus sometimes, off campus other times. I think that's going to be kind of the new normal that we've got. And on any given day, about 25 to 35% of our workforce will be working remote. I think that's significant in there in the fact that it will de-densify a little bit the campus, but also alleviate some of the parking, sustainability efforts that we've been working with, but at the same time, still provide enough activity on campus to make it feel like it is a true vibrant campus of higher ed. That being said, I want to emphasize that at the end of the day, these decisions will be made at the department level, Chris.
Yeah. To that end, this feels like a loaded question. Maybe it come from my staff. How are you encouraging managers to be more flexible as they manage in-person, remote, and a hybrid telecommuting employees?
Let me remind everybody that we are still in the midst of a pandemic, and I think I'm probably preaching from the data to most of the vaccinated choir here. But I don't think that I'm going to be contradicting Dr. Good or any of our medical experts saying the best thing that we can do is get vaccinated. So encourage your family, encourage your friends, go do that. To the specific question, we're committed to making the workplace as safe as possible, and we'll take all the steps that have been mentioned to encourage wearing masks, education and availability of the vaccines, cleaning the spaces between classes, and looking at that, having the guideline of values to help supervisors with their analysis for how to make this hybrid work arrangement work. However, I do want to be, again, emphasize and be clear that at the end of the day, those are going to be very local decisions down at the department level.
Yeah. And just like we've got the best students in the world, we've also got the best faculty and staff in the world.
For sure.
So I know we're all working together to try to do the right thing. All right, Dr. Reed, I'm going to come to you for the last few questions to close this out. And these are very specific classroom questions. Before I do that, though, I do want to point out wellness.utah.edu has a series of training programs about supporting faculty and staff in dealing with upset, disruptive students or other folks. And so there are a lot of resources out there. And we'll put this in the transcript when we get done. But I do want to point out there's just a tremendous number of resources. And again, if in doubt, be sure to visit coronavirus coronavirus.utah.edu. You can call the hotline, you can send an email, and a lot of good information there as well. All right, Dr. Reed, just a few questions and we'll be done here in the classroom. Is the focus. So do faculty need to create two versions of their classes to accommodate those students isolating or who simply prefer taking online classes right now?
No, if your class meets in person, you're not expected to create multiple modalities. You are expected, of course, just as would be true in non-pandemic environments, to accommodate students who are ill and unable to attend class. And there are many ways to do that, but it does not necessarily require creating second modalities. And while I'm talking, I just want to reemphasize the fact that we navigated last spring together, and the fall as well, and we will navigate this together. We've learned a lot about how to treat COVID. We have vaccinations, which we did not have when this started. We know what best public health practices are. And my general plea is that we rally together in a One Utah spirit and work together, faculty, staff, and students. That's really was the gist of the ask that Dr. Good and I made about come together, support one another, and we will continue to navigate this process successfully.
And you touched on this earlier, but I'll just ask it a little bit differently, a little bit more directly. What are plans to accommodate faculty who might get COVID and have to miss class or isolate, who might have to miss to isolate or quarantine?
Well, certainly, as I said, if the faculty member does get COVID and is well enough to teach, they can certainly offer the class virtually in that transition period and then come back in person if the course were in person. It's the same thing that would happen in a normal situation. If a faculty member became sick, colleagues in the unit would step up and help with the process. So that goes back to what I just said. We're family, we'll work together. That's who we are. That's what One Utah is all about.
And then finally, last question, can faculty hold Zoom only office hours instead of meeting in person with students?
Well, as Jeff Herring said, we want faculty to have flexibility and encourage people to do the appropriate thing. Having said that, we are very much expecting to have an in-person experience this fall as mandated by state law. And so within those constraints of flexibility, I'd certainly encourage faculty to meet with students in person. As Dr. McDonald said earlier, our students have a huge pent-up demand to be on campus and to have that personal interaction, and that's part of what being there for them is about. But of course, there are exceptions for people who have ADA accommodations, absolutely. But think about it from all perspectives. What will help the student? How do you balance your own health and safety? So there's not a hard and fast answer, but be flexible and meet people where they are.
So thank you to all of our panelists. We're just a couple minutes over, excuse me, but I want to thank Sean Wood and Melody Murdoch with University Marketing Communications for setting this up, for taking the questions and helping us arrange this. So my thanks to them. My thanks to President Randall and his leadership team. I have a feeling we'll be doing some more of these, and we know there's a lot of information. We just provided a lot of information to process. So in the coming days, we will get this video posted on @the coronavirus.utah.edu. We'll have a transcript. And again, I think the major takeaway here is 1, get vaccinated, 2, take advantage of all the resources the university has, and we look forward to seeing everyone here in person in a couple of weeks on campus. So with that, I'll close this out, and thank you everyone for participating.